starts as soon as I walk through the door. I see that I'm checking for safety, for any wires or Foley bags are on the ground. I see my patient isn't in visual distress, so I can walk in. Hi, my name's Anna. I'm going to be your nurse today. How are you feeling today?
Good.
Good. I'm going to do hand hygiene, draw the curtain for privacy. Can I have your name and date of birth?
Christina DePaula, June 4th.
June 4th. And okay, and I'm looking at the bracelet and it's the same. Very good. Okay, Christina, I'm going to be your nurse today, and if it's okay with you, we're going to do a full head-to-toe assessment. Do you have any spiritual needs you want to talk to me about before we begin? I have to go from top to bottom.
No, I'm good.
Okay, and do you have any family members that you want to relay the information to?
Yeah, my dog just follows me everywhere.
Okay, very good.
She'll bark.
Alright, so we're going to get started on the head-to-toe assessment. Are you in any pain?
No.
Okay, so it's a 0 out of a 0 to 10 scale?
Yes.
Okay, very good. So we're going to start with some vitals. So I took your temperature, and it was great. It was 98.6. We checked your pulse ox, was 99. It was great with your pulse oximeter. I could check your heart rate apically, would be on your left side, mid-clavicular, fifth intercostal space. I listened for a whole minute, and it was perfect. It was 65 beats per minute, regular, and it was within normal range. Next, we can do your blood pressure, where I would find your brachial pulse. I would get a blood pressure cuff is snug around your arm. Then I put the stethoscope on your brachial, and I would get your blood pressure, and it was great. It was 120/80. That's perfect. I can also check your radial pulses bilaterally if you're even. Great. So I put my gloves on, and we're going to start your head-to-toe assessment. So, Christy, I'm going to ask you a few silly questions.
Okay.
Do you know where you are right now?
In the hospital.
Good. Do you know what today's date is?
March 28th.
Good. Okay. So now we're going to start with the head. We're going to inspect and palpate the scalp. There's no bumps. It's smooth. No soft spots. No signs of alopecia. The hair is clean. No signs of lice or dandruff. Hair is done. It looks nice. Now we're going to move down to the eyes. We notice that they're symmetrical to her face. The conjunctiva is pink and the sclera is white. And there's no signs of drainage or discharge or bleeding or crusts. I'm going to get my pen light. I'm going to shine it in your eye. You're just going to look at my nose, and I'm going to shine it into your pupils. Checking the perla for pupils are equal, round, reactive to light, and then they constricted with the light. And can you take a look at the pen light, and then pulling it closer to her nose, and her eyes accommodate, which is great. And Christina, again, can you take a look at my pen light? You're going to keep your head still, and I'm going to check the 6 cranial sites. Okay, good. Next, we're going to look into the ears. There's no drainage, no bleeding, no pots, no excess hair. If I were to look in it, I would pull the pin up and back. She isn't wearing hearing aids, so if she was, I would ask where they are if they're not in. And then, Christina, which side do you hear this in?
The left.
And this one?
The right.
Okay, good. Next, we can go to the nose. It is perfect symmetry. There's no swelling, no discharge, bleeding, drainage. There's there's no nasal flaring. She's not using her accessory muscles to breathe. Her face skin looks good. The color's there. Then I'm gonna get a tongue depressor. We're gonna check out the mouth, and you're gonna say ah, ah. Okay, we're gonna check the mucous membranes. The tongues look good. The gums look good. The teeth look good. She has all her teeth. She's pink. There's no signs of cyanosis or blur. No signs of dehydration. The tongue's pink. I said that already. She has all her teeth, but if she didn't have all her teeth, I'd ask if she had dentures, and if they're not in, where are they? Then hydration, texture, no funky odor coming from the mouth, no signs of sores. And I also notice the patient has smiled at me and she talks, and it's your talk is not slurred. There's signs of symmetry, so no signs of stroke. So what was the last thing that you ate? What did you have for
Had
breakfast?
toast with egg.
Good. Okay, so I know that she's actually eating something, and I actually know that she's telling me the truth because I saw her eat it. Next, we could start checking the neck. We're going to palpate the neck for swelling. No signs of edema. And the trachea is midline, and I'm going to ask you to swallow. Good. And there's no divots in the sternum, the clavicular area. I can also check the carotid pulses now, not at the same time. I can also check the temporal pulses. They're equal. Next, we can inspect and palpate the chest. And you could take a deep breath in and out. And I'm going to be checking the bronchial out. Bronchiovesicular, bronchiovesicular, vesicular, vesicular. So take a deep breath in. Okay, good. And then I'll check the back when we get there. Now, I'm going to check the heart sounds. We're listening for the love dub. The aortic is the right intercostal space, second intercostal space from the sternum. Then we're checking the second intercostal space on the left side, which is the pulmonic. And you can just breathe on like it. Then you're going to check Erb's point, which is the left third intercostal space. Fourth is the tricuspid fourth intercostal space on the left side. Fifth is the mitral, right intercostal space, midclavicular. Next, we're going to go to the abdomen. First, we're going to inspect and then auscultate, palpate, and percuss. There's no distensions, but we're going to start in the right lower quadrant. We're listening for bowel sounds. If I hear it, I move on. Good bowel sounds. And if I didn't hear anything, I'll listen for 5 minutes. Now we're going to palpate. No signs of tumor, masses, or just abs. Are you having any pain?
Mm-mm.
No, okay. Then we can percuss. Now, Christine, when was your last bowel movement?
This morning.
This morning. It was normal?
Yes.
Okay. And are you having any problems urinating?
Oh.
Any burning?
No.
No. Okay. Any vaginal bleeding or discharge?
No.
No. And if she was a male, I would ask the same if there was anything coming from the penis. Also, I would ask her when her last menstrual period was, and then we can go back up to the arms. We can palpate the skin, the shoulders for edema. We can look at the elbows for redness, shoulders, and range of motion. Can you lift your arms up above your head? Good. Can you bend them? Good. And then you're going to press against. Good. you squeeze my fingers? On the other side. Good. And we're also always checking the skin for signs of turgor, dehydration, temperature's nice and warm, pink. No signs of rashes, edema. We're going to check capillary refills. We're going to press on the nail beds. And it comes back in less than 3 seconds, so it's good. Now we're going to work our way down to the legs. We're always checking for turgor, skin, dehydration, redness, pitting edema, rashes, redness, skin breakdown. We can check the back of the heels for any pressure ulcers. We're also going down to the feet for pitting edema. We're going to check the circulation, the dorsalis pedis bilaterally, and the posterior tibialis, both equal. Capillary refills, good. Now, Christina, can you push against my hands? Yep, and now flex. Good. And then now can you lift one leg up? Good. And down. Good. And good. Good. Can you bend your knees? Good. Good range of motion. Good. Okay. And now, Christina, can you just sit on the side of the bed? We're going to just check the your lung sounds. And then now, if they were turning on their left side, Sims position, we'd be checking their bone prominence, the sacral region, the back of the heels, the shoulder blades, checking the skin for pressure ulcers, skin breakdown, back of the head. So now we're going to check lung sounds. We're going to check for wheezing, bronchi, stridor. We're starting on the left side. We're not going to go on the scapula or the spine, so we're going to take a deep breath in. Any dizziness?
No.
Okay, good. And they sound great. Also, if she was lying on Sims position, we would check the rectum for hemorrhoids or bleeding or anything funky going on over there. Okay. You can lay back down and get comfortable if you'd like. You feeling all right? Any pain?
No.
Okay.
Good, thank you.
All right. So how'd you do with your head to toe assessment? You're all done.